dementia researcher with a blog and a rating.
Genetically determined Alzheimer's disease. Recap from the latest conference. Although genetically determined forms of Alzheimer's disease are rare, they have been, and still are, crucial in research to understand Alzheimer's disease mechanisms, pathogenesis, and etiology. Including both familial types of Alzheimer's disease, autosomal dominant, and Down syndrome Alzheimer's disease. A newly established conference termed ADAD-DSAD explores the commonalities between these two groups. In this blog, I will discuss the outcomes from this meeting and the important discussions it hosted. Autosomal dominant Alzheimer's disease, ADAD, is caused by a dominantly inherited mutation in the amyloid precursor protein, APP, presenilin 1 or presenilin 2 genes. APP is the protein which is cleaved to form the amyloid beta peptide, which aggregates to form the hallmark amyloid beta plaques in Alzheimer's disease. The cleavage of APP is carried out by secretase enzymes, including the gamma secretase. The presenilins are subunits of the gamma secretase complex. Therefore, mutations in APP, presenilin 1 or presenilin 2 lead to the production of longer, more aggregation-prone amyloid beta peptides, resulting in Alzheimer's disease. These mutations are hereditary, running in families, and make up approximately 1% of all Alzheimer's cases. Age at onset of dementia symptoms is much younger than in the general population, with disease diagnosis occurring in middle life. Down syndrome is a second type of genetically determined Alzheimer's disease, resulting from trisomy of chromosome 21, on which the APP gene is encoded. People with Down syndrome have a third copy of APP, resulting in increased amyloid beta production and deposition. The age of disease onset in Down syndrome is also significantly younger than in the general population, with the average age of dementia diagnosis being 55 years in the UK. Drawing on their similarities and opportunities to learn from the commonalities between these two types of genetically determined Alzheimer's disease, the ADAD-DSAD conference was established in 2024, dedicated to sharing research on these two fields. I recently attended the second instalment of this conference in the beautiful setting of Hospital Modern Sant Pau, Barcelona. The conference largely had a human data focus, with sessions ranging from human neuropathology to neuroimaging biomarkers to Alzheimer's disease clinical trials. A strong theme across many talks at the meeting focused on understanding how the APOE genotype of an individual can influence the age at disease onset in genetically determined Alzheimer's disease. In sporadic Alzheimer's disease in the general population, being an APOE epsilon 4 allele carrier is associated with increased risk for developing Alzheimer's disease, with homozygosity for APOE4 having an 11-fold increase in lifetime risk. But in individuals predetermined to get Alzheimer's disease, does this risk allele have an effect? The consensus across multiple talks was that it had a moderate effect at causing an earlier age at symptom onset. This discussion was furthered by a focused session led by Professor John Hardy and Dr. Juan Fortia on how can we actually classify genetically determined Alzheimer's disease. Research led by Dr. Fortia's group, published in 2024, showed that individuals homozygous for APOE4 were almost guaranteed to develop Alzheimer's disease if they lived long enough. Dr. Fortia argued that in the case of cancer, such as the BRCA gene mutations which cause breast cancer and have a 50% chance of disease, no one would argue that that is not genetically determined. Other audience members suggested that without any real treatments, considering APOE4 homozygosity, a genetic form of AD, is risky for both patients and clinicians. This was a fascinating and thought-provoking discussion, and a debate which I will be sure will continue in the coming years. Another highlight of this meeting was the dedicated session on clinical trials for Alzheimer's disease modifying therapies, specifically for these populations. The current usage guidelines for approved anti-amyloid beta immunotherapies, lecanemab and donanemab, exclude individuals with Down syndrome over concerns of the side effect of amyloid-related imaging abnormalities. This side effect, termed ARIA, is associated with brain bleeds or swelling, and symptomatically can be seen as headache, confusion, but in severe cases, death. Until now, no clinical trials for these therapies included people with Down syndrome. At the conference, Professor Michael Raffi gave an update on 3 clinical trials specifically for people with Down syndrome, which will have all commenced by the end of 2025. These include the HERO study, which will test the safety of a genetic therapy, and the Aladdin study, which will treat people with Down syndrome with the existing drug donanemab. Others at the meeting, including Professor John Hardy, stressed how unfair it is that people with Down syndrome have been excluded up to this point, despite the foundation of the amyloid hypothesis on which these therapies are based, coming from data from people with Down syndrome. Therefore, this marks a positive step forward for the Down syndrome community. The final standout session of the meeting for me was a science and society session that included 2 people with Down syndrome, Laia and Greta, along with each of their mothers and other panel members who have lived experience of Down syndrome or who are working with people with Down syndrome. Laia and Greta themselves touched on how they have participated in various research studies, but they also gave feedback to the community on what could improve their experience. They touched on having negative experiences with certain staff when having procedures such as MRI scans, having to attend clinics for lengthy periods, and having no contact from research on the outcome of studies in which they partook. These actionable points can hopefully be considered in future research study design and highlights the importance of PPIE in research. Overall, this conference excelled at tackling the niche of genetically determined Alzheimer's disease and applying finding back to the general population too. The full conference recording is available on YouTube, and I would highly recommend it for anyone in the Alzheimer's field so they can browse the relevant sections.
Thank you for listening. Join the Dementia Research bloggers and share your own views.